would you describe the current state of the Philippines healthcare system?
Well, I've been a doctor for many years, and true enough, many patients will come pagka na sila, when they cannot work, they cannot go to earn money.
Yeah.
That's the time they will go to the hospital or to the doctor. So that's a little bit too late. So we're trying to change that kind of behavior. When we passed the Universal Healthcare Law for the Philippines, where that means access, equitable for healthcare, accessible, equitable, and affordable. So those are the three elements of Universal Healthcare Law. So yung access, nagtayo ako ng BUCAS centers. These are the Bagong Urgent Care and Ambulatory Services Center. I now have 61 operating all over the country. I only targeted to build 28. Now I have 61 all over the nation. I just inaugurated the most recent one in Tolosa, Leyte, number 61.
Okay.
And it's a polyclinic or urgent care that's available in the community.
Right.
It's like a hospital without the bed. So everything you needed in a hospital. Alam mo kasi, Angela, 80% of the people that go to these very big, busy hospitals just want outpatient diagnostics, a consultation, and then a prescription and medicines, and then they'll go home. Nobody wants to be admitted. The problem is 80% go to the big DOH hospitals that have been developed over the years. Kasi nagkaroon ng syntax, nagka-funding, na-develop yung 83 DOH modern facilities. But it also caused an overcrowding because yung mga tao, binaypass na nila yung local government hospitals, yung barangay health stations, because anyway, the equipment and the diagnostics are enormous.
Right.
So ngayon, binadala ko naman yung community center.
Well, that's a good initiative, no? Because a patient's journey doesn't end, diba, in the hospital alone. Kailangan nila ng mga laboratories and medicines are greatly important
and imaging,
as well.
yung X-ray, ultrasound, CT scan, yan ang mga kailangan ng pasyente. With the modern day of how we practice medicine, iba na nung araw.
Right.
Stethoscope, prescription, paper, okay na ang doctor. Today, i-X-ray ka, ultrasound ka, CT scan ka pa. So, medyo nag-iba yung the way we treat patients. But we also now do a lot of outpatient operations. We also do a lot of procedures. So if we can do them na parang fast food, like what happened with the BUCAS is, it's open from 6 a.m. to 10 p.m. I use 2 shifts of personnel. And there's urgent care. So if you have an emergency, you don't have to go to a big emergency department na pipila ka for long hours. And then matagal bago ka tingnan.
Panis ka nakakaantay.
Uunahin kasi nila yung namamatay. It's called the triage system. So if
right.
you're that dying, they make you wait for hours.
True,
Yeah, so that's
which
what
makes
happens.
sense naman, di ba?
So we want to decongest that and you bring you to a place na run by the family and community medicine people. So in 1 to 2 hours, na-process ka nila and it's successful.
Pero ito po, may bayad yung mga services. Free din to.
So it's also, all the services
DOH.
are government. So the diagnostic tests are free. It's all covered by PhilHealth. So
are we also planning to expand it sa mga far-flung areas, which is mas kailangan ng mga tao dun because ang hirap yung accessibility sa kanila.
So I took another loan. So I took a loan from the World Bank. It's $400 million. And it's for a 4-year project to build 250 health facilities, health centers that are modern with solar power, Starlink or internet connection, and all the diagnostics that are available point of care. And this, we identified 17 provinces, GIDA areas. We called it geographically isolated and disadvantaged areas. So the idea to start building those. So that commenced last September. So I'm due to build 250 of this in the next 4 years. So this is like the next step, the BUCAS, and then the primary care facility, another health facility for diagnostics. The title of this project was the Health Systems Resiliency Project. You can Google it online. And it's about increasing capacity in the rural areas,